Yes, karibu sana daktari. This is my office.
Wow, I'm so glad to be here at last.
Welcome.
Thank you, Madam Veronica.
Yes.
This is a wonderful place, the Phoenix. And I've actually seen a wonderful facility and in a good space. Probably just let us get to know who Veronica is. As I told you, this is the mental health hub. What the mental health hub does is to endeavor to create awareness on matters mental health. As you are aware, today it is a big challenge. It is a need in the community. So this space works to be able to create awareness on the issues mental health, for purposes of actually ensuring that the community is enlightened, so that then early identification can happen and support and care can actually follow. So the mental health hub exists to really create awareness, to sensitize the community on matters mental health. For as we say, there is no health without mental health. So I am sure Phoenix is playing a role in mental health. Let's get to hear who Veronica is and who Phoenix is.
Welcome again, Dr. Kathuru. This is the Phoenix Rehabilitation Center, where we admit people who have substance use disorders. And as I said, my name there, I alone. I'm Veronica Angelo. I work at Phoenix Rehabilitation Center. And again, as I said, we deal with the people who have substance use disorders. Could be alcohol, could be bangi, could be mera, and general mental health issues that have been caused probably by these substances. We have been in existence since 2020 during the COVID time. And we continue to do the good work. We admit both genders, male and female, and we've had quite a number of people in this place, and we are glad also to announce that many people who have left this place have called back and said their lives have changed, and that's what makes our day really when we help people. I have been in this field for the last 37 years.
37 years.
I qualified as a registered nurse.
Wow.
I have worked both within the country and outside the country. And recently, I worked at the Chiromo Medical Group of Hospitals.
And the Chiromo really is very well known for mental health issues.
Sure. And the quality of care is also very good in that place, I must admit. I must say that. So, and of course it reached a time when now I retired 2 years back, in August 2020. And I said, because I'm still strong and I have passion for mental health, I think I want to continue doing the same thing that I know best. Because I don't think I could do anything else other than mental health.
Something you have done for 37 years.
And then we decided to put up this place, to start this place with a group of other professionals. And we've been doing that since 2020.
I hear mental health 37 years. I'm looking at it. You know, today, as we speak about mental health, it looks like it's something that has just emerged. And you are referring to it 37 years ago. I take us back and let us see where that was. How was it then?
Actually, when I talk of 37 years, I was just not concentrating on mental health alone. It was general nursing. It could be midwifery, could be general nursing, could be public health. But then also we were also doing mental health. But in the last 22 years is when I now delve now to mental health.
Mm-hmm.
Is when I got really serious with the mental health issues.
Okay.
And especially in abroad.
Mm-hmm.
I worked in a hospital known as the Ealing Hospital. And then I came back to the country. That's when I went to Chiromo.
Mm-hmm.
And basically, that's what I've done for the last 22, 23 years now, mental health.
Going back like the first 10 years of being in this country and in the space of mental health, how was it as compared to these other 10 years? Probably compare the 2 decades. So that, because today when you hear people talk about mental health, it's like it never existed. It's like now it's a new thing that has come and it has caught us by surprise. But then, you who has been in the field for this long, help us to understand the 10 years and 10 years.
Yeah, maybe we can say 20 years,
Yes.
10 years before.
Sure.
Now, mental health has been in existence for a long, long time. Even when we went to college, your training, there were specific places for mental health patients, specifically. And they had a name, Ward 8. Well, that's what I can remember, Ward 8, Ward 8. And of course, when I compare then, the care then, and the care we have today, totally different.
Wow.
If I had been told there before, maybe to specialize in mental health, I would not have been very comfortable. Yes, I could do everything else. I could treat them well, take care of them, but specializing in that area, specifically dealing with those patients, considering the conditions that were put in those days, I would not have done that. But my life, my way of looking at mental health changed when I went abroad, and I realized that mental health is an illness like any other disease. Because in abroad, it is treated like you have pneumonia, you have malaria, it's like any other.
Okay.
And the government there is also making sure that the mental health patients are well taken care of, just like any other.
Yes, yeah. Okay.
Of course, when now I came back, and I went in a private hospital, and then you go there, then you realize the kind of people that you deal with are people who have been to school. They are doctors, they are lawyers, engineers. That's where they have ended up being. It could just be due to alcohol or addiction for that matter. Alcohol. Could be bangi, any other thing, or generally they're just sick.
Okay.
So basically what we are saying that the care that was offered those days in the 60s, in the 70s, in the 80s actually, in the 90s, is totally different from the care that people are receiving today.
Okay.
Because now today, people have come to understand that mental health is a disease like any other, and there is treatment, and people can get well, and they can get back on their feet, and go back to work, and become people who are, I won't say the word useful, but people who can do great things with their lives.
Manage their daily lives.
They manage their daily lives. And not only that, some of them are very senior people in this country. And they're doing well, as long as they have known how to manage their disease, to take their medicine, go for the doctor's clinics, attend counseling sessions when necessary. Basically, life becomes okay. That's what I've.
When you say that the care has improved, I tend to think, of course, science has contributed to the sense that now people understand mental health issues differently than then. Do you think research has helped us get a better understanding of this disease?
Yeah, research has, of course, done great in this area. And of course, we have more psychiatrists now in the country. We have trainings like clinical psychologists, we have counselors, something that was not there then, and if it was never recognized. But today, we have a registering body for counselors, isn't it?
Yeah, sure.
So, you know, and people are learning. And of course, now with the internet these days, people are able to learn quite a lot from and they know that yes, if I take my medication, if I visit the doctor, my life will be okay. And then again, of course, as we're saying, there before, of course, mental health was like a curse. It's no longer that. People now are educated. The world has become a global village. I can see what is happening in America, I can see what is happening in Britain or in any other country. And we are able now to compare notes and make informed choices.
So it's like demystifying the myths that have been existing there.
Yes.
And then making it clearer that this actually is a disease. And I'm looking at it now from that perspective, is that us who are, or these people who are learning, the psychologists, the psychiatrists, the counselors, the multisectoral approach, the multidisciplinaries that are in this space, understand it. Now, what of the community? From where these clients are coming? Is there a balance? Because the professionals are on this side waiting for clients to come. What is it with the community?
Oh, in the communities, that's a good question, because what has happened now is that we also have these professionals in places like churches, and they're talking about mental health. We have schools now, most teachers are trained as psychologists, as counselors, so they're also educating the children there. And I'm sure during their PTA meetings, they also talk about it to the parents. Yeah, so people now are beginning to understand what mental health is, and it's no longer a shame anyway. It's no longer a shame. People are talking about it, as I've said, in churches, in schools, and probably also in marketplaces. People are talking about it.
Yes, sure.
Yeah.
So the understanding is helping us actually get to do early identification.
Early identification and early intervention makes all the difference. Because if mental health is caught pretty early, somebody started on counseling, somebody started on treatment, then what it means is that they can be able to achieve much in life.
True. And you know, they say prevention is better than cure. As a professional who has been in this space for 20 years plus,
yes,
what is your position? Do we do prevention, or we sit and wait for people to get healed, then we start managing?
Like what we were doing about 10 years back is we would go and talk to the corporate world, insurance companies, churches, schools, basically just creating mental health awareness. And therefore, also early intervention. Even educating people like HR, they'll be able to notice 1, 2, 3 things about somebody, and they're able to intervene in good time. And therefore, treatment. I'm glad that even now the insurance companies have embraced mental health, and most of them now have a policy, and it's getting more clear that you cannot have a country, you cannot have a meaningful life without actually good mental health. So everybody is getting into it now.
Wow, I like that bit, that actually you made it clear that it's about our nation. It's about our society. It's about our development. Unless we have people that have good mental health status, then our development will actually be skewed. It's like we have a proportion of the community that is not contributing to the growth of our economy, and that becomes a loss to the society. And one thing strikes when you say that insurance is also taking up this space, considering that mental health treatment, what I have heard as I engage, is that it's expensive treatment. I don't know what you want to say about the fact that now the insurances are taking it up also to reduce the burden on the families.
Yeah, when you say mental health is expensive, yes, it is expensive. But it is even more expensive when not treated, when the mental illness is not treated. Because what is going to happen when somebody is mentally unstable, not well, and they don't go to work, they are financially in debt, what happens to that family when they lose their job? What happens to that company when they're not able to be as productive as they expect to be? Who will do that shift? Let's say, for example, it's a factory. That person, you're in charge of this, or somebody is supposed to be there, you don't come to work today, you don't come to work tomorrow and the day after. What's going to happen in that? How is going to be that production? It will be affected, isn't it? So when it is affected, what happens financially for this organization? So it is good that corporate world organizations make sure that they actually have their employees checked in good time, or apply intervention methods at the place of work, so that they are able to help this person as an individual. They also help the organization to grow, and for the betterment of the country or the nation, economically, financially, family-wise, etc. So it is more expensive when you don't treat somebody than it is
when you intervene. When you intervene. I hear you say that basically that interventions, doing something is cheaper than doing nothing when it comes to mental health. And you have brought a point that the workplaces should be an entry point.
A stitch in time, that's what?
Saves
a lot.
Yes. Okay, that is a good thing.
Because let's say, for example, I'm not well, or have been in addiction, maybe alcohol, maybe it's alcohol or bangi or whatever it is for quite some time, and I've not been seen by the doctor, I've not even gone for counseling, I've not even received any treatment. Medically, what's going to happen? Medically, what is happening to my physical health? What is happening to my liver? What is happening to my systems? What am I doing to that organization?
Sure. You're not adding value.
You're not adding value, isn't it? So I think early intervention is key. Because what is going to happen when we don't intervene pretty early is that this person is going to deteriorate mentally, medically, for a long time, and that person will not be useful in life again.
Becomes a burden to the family, becomes a burden to the country, becomes a loss to the nation. Because definitely with the progression of the disease, we likely lose the person, isn't it?
That's what happens.
Yeah, so as you say, I really want to agree with the fact that early diagnosis and of course treatment and management of mental health issues is the best way to go.
That's the best way.
And I sit here and ask myself, with your experience of many years in this space, what would you tell the young professionals who are joining this space? Because as you pointed out that, you realize now of late we have increased numbers of psychologists, counselors, psychiatrists, so the response team is growing. And others also desire to enter to meet this need. What would you tell such professionals?
Such professionals, I'll tell them, get into something because you have passion. Or that's the area you want to delve in. Get yourself a good mentor. Work with somebody. And you will do great wonders. Make a point of also going back to school, learning a lot, researching. help as many people as you can. Let it be your job. If you decide mental health is going to be your thing, it may be difficult, but it is very rewarding.
It's rewarding.
When you see people come back and they say, I'm feeling much better, I'm back now to college, I'm back to work, etc., etc., there's nothing as rewarding as that. But you need to have great passion for that job, because there's quite a lot. You will deal with quite a lot of complex issues, but we thank God that we have schools, we have universities these days that we learn some of these things from.
Okay.
So, key number one, get yourself a good mentor.
Sure.
Go back to school. Go for this thing because you have passion for it. And sometimes there is also a way of creating passion yourself over something.
Sure.
Yes.
Get interested in what you want to do.
Get interested in what you want to do.
Get interested in this space.
Yes.
And it gives you gratification.
Gratification of highest order, I can tell you. You'll be able to help as many people as possible. You'll also be able to help yourself, help your families, your relatives.
It's a career. That's what you're saying?
Yes, it's a career.
And a good one?
And a good one.
Wow.
Oh yes, a good one.
It's a good one.
It is a good one, yes.
Wow. So I hear those young people out there in college probably or in secondary school, this is one of the careers also they can be able to focus.
You see what happens, you can still do your psychology, counseling, and still be able to do something else. Let's say, for example, you want to be a pilot, you want to be an engineer, but you can still do counseling on the side. That when you're doing this, you're also doing helping other people at your place of work, in the family space, church, in organizations. Make a difference in the world.
Make a difference in the world. What a nice clarion call. But make a difference in the world. Where does Veronica see herself 5 years from now?
5 years, I'm thinking that we will have grown the Phoenix Rehabilitation Center. We will have helped as many people as possible. And the other thing we are thinking about is to make a rehabilitation center that is a good place. I mean, we want when people come to the rehabilitation center, they have come for help, not as a punishment. So, and to recover with a difference, dignity, etc. Such that that person, when they leave this place, they will be able to help somebody else because they have gotten it. So, in 5 years, probably we'll have grown. Maybe another place. Another place will have come.
You'll be growing because you'll be meeting the needs of the people.
The needs of the people, and the fact that now also the government has accepted that we have an issue, we have a problem.
Yes.
We have a problem, and it needs to be tackled. And who else is going to do that? Just us.
Yeah.
Yes.
It is our space.
Yes.
Great. Maybe what would you like, maybe as we close, to tell that person out there who has been in the rear and is now trying to maintain sobriety? What would you tell them, and probably by extension the family as a support mechanism?
What I would like to tell those people who have already left the rehabilitation center is that, yes, we are out there. The challenge would be how to stay sober without that drink, without that path. When you're in the rehabilitation center, of course, there is a lot that we learn. It is good to be able to practice that, what you have learned. And any time you feel like falling back, call your counselor, call a friend and say, this is what I'm facing. Discuss it. It's a strive. You strive. You have to strive, because the minute you fall back, you're going to start from standard 1, standard 2, standard 3, isn't it? But when you strive, you care 1 month, 2 months, 3 months, 1 year, another year, without a drink, without that puff, you're doing great things for yourself.
Wow.
That
Great.
is what I would like to tell those people who are in. To the caregivers, it's a challenge. Sometimes caregivers have felt so drained, so overwhelmed, because it's also very costly.
Yeah, sure.
It is emotionally draining. And sometimes a caregiver or a mother or a parent for that matter wonders what is that they didn't do. It is important for the caregivers also to seek help.
Okay.
It's good to join some support groups. Look for a counselor, good counselor. Look for a good probably pastor. Talk about your issues. Get good support.
Wonderful.
For yourself.
Support.
All the time.
Especially for the family members, even who are dealing with someone who has come from a facility, a rehabilitation facility.
Yes.
And as the mental health hub, as we usually say, this space is here to be able to be of the support to you as an individual who is dealing with a mental health issue, with a drug issue, and as families, as the support mechanism. Do not give up. As Veronica has said, it is a tough journey, but it is worthy doing it because it's the right of this person to live, and their health is a right for them. And every one person you support, it goes beyond that person, because at the end of the day, you are supporting your nation, you are supporting a system. Thank you, and see you next time.